Blood-borne pathogens are disease-causing microorganisms that are present in human blood. Microorganisms are very tiny one-celled organisms, viruses, fungi, and bacteria that are found in all living things, plants, and animals. Some of them, pathogens, can be harmful and cause diseases. The most serious types are the human immunodeficiency virus, or HIV, hepatitis B virus, and hepatitis C virus. They are transmitted when blood or body fluids from an infected person enter the rescuer's body. There are two methods of workplace exposure: through a direct splash on a rescuer's eyes, mouth, or nose, or through a break in the rescuer's skin, such as a scab, fresh cut, puncture, or rash. At an emergency scene, it is impossible to tell if a victim has an infectious disease that could be passed along to the rescuer. There is a risk that you may be exposed to blood and body fluids. You can greatly reduce your risk of exposure by taking precautions and wearing protective equipment. Use universal precautions to prevent exposure when treating victims. Take precautions with all victims. Use personal protective equipment. Personal protective equipment includes moisture-proof gloves, gown, mask, and goggles, and a CPR barrier device for rescue breathing. For additional protection, avoid contact with all moist and potentially infectious body substances except sweat. Wash hands immediately after glove removal with soap and running water. Rub your hands together to make a lather. Spend at least 20 seconds thoroughly scrubbing your hands. Rinse well under running water and dry with a paper towel or air dryer. If your hands are not visibly soiled and a hand wash facility is not readily available, you may use an alcohol-based hand sanitizer to clean your hands, then wash with soap and water as soon as you are able to. Even with proper protection, exposure can still occur. If you are exposed to blood or body fluids, take the following action. Wash any exposed areas immediately with soap and water. Spend at least 20 seconds thoroughly scrubbing your hands and any exposed areas. If splashes to the eyes, mouth, or nose occurred, flush the affected area thoroughly with water. Dispose of any contaminated clothing or objects in an approved leak-proof container. Report the exposure to your supervisor and follow up with a healthcare provider. Use non-latex gloves because of latex allergies. If possible, you should wash your hands before putting on gloves and always after removing them. Avoid splashing or dripping potentially infectious material when taking off your gloves. To properly remove your gloves, pinch the base of one glove and slowly peel it off. Hold the glove in the opposite hand, slip 1 or 2 fingers inside the remaining glove and carefully peel it off, creating a bag for both gloves. Dispose of them properly, according to your workplace policy. Because proper glove removal is so important, we'll take a moment to practice it with your instructor.